Welcome to MCQs Hub YouTube channel. Today video on Top Nursing MCQs. Q1. Normal compression to ventilation ratio. A. 32. B. 15:2. C. 2:30. D. 15:1. Correct option is A. 32. Q2. While using a cardiotocogram, the given fetal heart rate to uterine contraction relation shows the fetal heart rate gradually decreases and returns to baseline, but the nadir of the deceleration occurs after the peak of each uterine contraction. A. Early deceleration. B. Late deceleration. C. Variable deceleration. D. Acceleration. Correct option is B. Late deceleration. Q3. Contraindications of nasopharyngeal airway is A. Skull base fracture. B. Sedated patient. C. Unconscious. D. During dental procedures. Correct option is A. Skull base fracture. Q4. Complication of high flow of ventilation. A. Aspiration. B. Pneumothorax. C. Diaphragmatic hernia. D. COPT. Correct option is B. Pneumothorax. Q5. Identify the FiO2 rate in the given venturi mask. A. 40%. B. 31%. C. 60%. D. 28%. Correct option is A. 40%. Q6. A patient is having calcium level of 7 mg per deciliter. Identify ECG changes seen in this patient. A. T wave inversion. B. Prolonged QT interval. C. Prominent T wave. D. PQ wave. Correct option is B. Prolonged QT interval. Q7. Identify the abnormality seen in this patient. pH 7.5, PCO2 40, HCO3 22, Na 150, Cl 100. A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Correct option is A. Metabolic acidosis. Q8. During suctioning, the patient complains of respiratory distress. First nursing action should be A. Immediately remove suction catheter. B. Suction rapidly in 5 seconds and remove the catheter. C. Call senior nurse. D. Call doctor immediately. Correct option is A. Immediately remove suction catheter. Q9. The earliest symptom of hyponatremia is A. Fatigue. B. Ataxia. C. Thirst. D. Weakness. Correct option is A. Fatigue. Q10. The earliest sign of hypocalcemia is A. Twitching. B. Negative Chvostek sign. C. Weakness. D. Exaggerated DT hours. Correct option is A. Twitching. Q11. Patient has vitals. BP 120/66, pulse 1988, SpO2 1999, RR 23. This patient should be classified in which triage? A. Red. B. Yellow. C. Green. D. Black. Correct option is C. Green. Q12. Patient is having temp 104 FBP 140/90 mmHg, RR 28 per minute, pain scale 5. Which factor you will primarily manage in this patient? A. Temp 104 F. B. BP 140/90 mmHg. C. RR 30 per minute. D. Pain scale 5. Correct option is A. Temp 104 F. Q13. Patient has temp 103 FHR 110 per minute, RR 23 per minute, BP 132/66 mmHg. Which factor you will primarily manage in this patient? A. Temp 103 F. B. HR 110 per minute. C. RR 23 per minute. D. BP 132 by 66 mmHg. Correct option is A. Temp 103 F. Q14. According to ABC, which of the following describes improper cardiac circulation? A. Hypertension. B. Diminished pulse. C. Tachypnea. D. CRT less than 3 seconds. Correct option is B. Diminished pulse. Q15. During 4 administration, which of the following drug causes extravasation and damage to sight? A. Diazepam. B. Epinephrine. C. Phenytoin. D. Ranitidine. Correct option is C. Phenytoin. Q16. The trans-illumination procedure is done with A. Venipuncture. B. Angiography. C. Blood culture. D. Bone marrow aspiration. Correct option is A. Venipuncture. Q17. In a 3-year child, which of the following is the best complementary feed that can be given to this child? A. Mashed bananas. B. Dal rice. C. Fruit juice. D. Boiled soft carrot. Correct option is B. Dal rice. Q18. A child is on CPAP and is hemodynamically stable. Which of the following is the best method of feeding this child? A. Breastfeeding. B. Nasogastric feeding. C. Cup feeding. D. 4 fluids. Correct option is B. Nasogastric feeding. Q19. In a 4.5 mm ET tube, what size of suction catheter is used? A. 10 French, FR. B. 12 French, FR. C. 15 French, FR. D. 18 French, FR. Correct option is A. 10 French, FR. Q20. WHO declared COVID-19 a public health emergency on A. 13th January 2020. B. 30th January 2020. C. 31st January 2020. D. 20th January 2020. Correct option is B. 30th January 2020. Q21. The normal interval of the QRS complex is A. 0.08 seconds. B. 0.12 seconds. C. 0.16 seconds. D. 0.4 seconds. Correct option is A. 0.08 seconds. Q22. The flow rate of a drug is shown as 50 ml in 15 minutes. The correct flow rate of this drug is A. 150 ml hour. B. 50 ml hour. C. 200 ml hour. D. 100 ml hour. Correct option is C. 200 ml hour. Q23. For a patient, the desired dose of a drug is 200 mg BD. The available dose of this drug is 0.1 gram. The correct dosage for 1 dose of this drug is A. 1 tab. B. 2 tab. C. 3 tab. D. 4 tab. Correct option is B. 2 tab. Q24. Desired dose of morphine for a patient is 0.4 mg. Dose available is 1 mg per ml. The correct formulation for this patient is A. 0.4 ml. B. 0.8 ml. C. 0.2 ml. D. 0.3 ml. Correct option is A. 0.4 ml. Q25. An asthma patient comes to emergency with complaints of wheezing and chest pain. What should be the flow rate of oxygen for this patient? A. 2 liters per minute. B. 5 liters per minute. C. 10 liters per minute. D. 15 liters per minute. Correct option is A. 2 liters per minute. Q26. In a patient, Apical pulse is 80 per minute and radial pulse is 65 per minute. Identify pulse deficit. A 10, B 15, C 25, D 35. Correct option is B 15, Q 27. In a newborn, Mcqs score at 1 minute is 7. Nurse found that the baby's mouth corner is stained with secretions of meconium. What is the next best step? A. Prepare for resuscitation. B. Inform physician. C. Perform the suction of mouth and nose. D. Perform the routine care. Correct option is C. Perform the suction of mouth and nose. Q. 28. Function of zinc in management of diarrhea is A. Increases appetite. B. Resolves abdominal cramps. C. Maintains hydration. D. Prevents induration. Correct option is C. Maintains hydration. Thanks for watching. Now subscribe MCQ.